There is a large number of men, women, and children who don't have access to health care, either by virtue of loss of income, loss of job. Interestingly enough, I now see an awful lot of people who used to have insurance, mom and dad work, they're not accustomed to food lines and help, and they come in teary-eyed and say, we don't have any resources anymore, can you see us? We see a lot of men and women who not only recently lost health care, but haven't had it for a long time. So it's not uncommon for us to get people with advanced stages of disease like diabetes or hypertension or high cholesterol. And as you well know, anybody knows, the more advanced a medical condition is, the more difficult it is to get it under control. Ingham Health Plan does a wonderful job of helping us to minimize that. I think one of the biggest losers, if it were not for IHP, I think the biggest losers are people that would not have health care. But very close behind that are the hospitals and the urgent cares who, they can't turn people away. When people walk in the door, they must care for them. Without the advantage of preventive care, a lot more emergency room visits occur. But the other point is that it costs you more money because your insurance companies look and see what they have to pay for health care that isn't compensated. The hospitals charge on the basis of it, the urgent cares charge on the basis of it, and your costs go up. There's a lot of question now about what's going to happen in 2014. Number one, we don't know whether the Obama plan is going to be in effect, and if it is, it probably won't be 100% anyway. And then we start looking at, well, who's going to be left over that won't fit? The numbers that I have, it seems like we're still going to have the same number of people looking to find physicians, not able to. We already have 2 federal funded health plans. We have Medicaid and we have Medicare. Yeah, the state runs the Medicaid, but we can't find people to see them now. We can't find enough physicians and healthcare providers to see our Medicare and Medicaid patients. What's going to make it different? That scares me. That scares me and concerns me.